Hello, everyone. I'm Dr. Renee Mehrra. Thank you so much for joining Zoom In with Renee. Today, my guest is going to talk about diabetic retinopathy, which causes vision loss and even blindness in people who are diabetic and their blood sugar is not properly controlled. According to the Centers for Disease Control and Prevention, in 2021, over 9.6 million people were diagnosed with diabetic retinopathy, and out of which 1.8 million are living with threatening vision due to diabetic retinopathy. Joining me today is Dr. Deep Parikh. Dr. Parikh is an ophthalmologist and a retina specialist. He's the Associate Clinical Professor of Ophthalmology at NYU Infirmary of Mount Sinai and NYU.
Hi, Dr. Renee. Thank you for having me on. I think this is such an important topic, and I'm glad we're discussing it this morning.
Absolutely, and I want viewers to understand that we should take an active role if you see yourself or your loved one suffering from diabetic retinopathy, because early intervention is the key for seeing that it doesn't get advanced. So we know that people who are diabetic are the ones who are going to be prone to diabetic retinopathy if their blood sugar is not controlled. Let's talk about the symptoms. We spot the symptoms early enough, but that it doesn't progress.
Excellent points. And the problem with diabetes, and especially early stage diabetes, is of course it doesn't really have very obvious symptoms, right? So a lot of patients are out there where they haven't seen their primary care doctor, they haven't seen their medical doctor in quite some time, and they may not even know they have diabetes. And that's part of one of the issues. When people do have diabetes for a long period of time, and like you mentioned, their sugars are uncontrolled, of course, diabetes can affect any part of the body, but one of the earliest places it affects is the retina in the back of the eye.
It's causing damage to the blood vessels in the retina.
Yeah, but not only the retina, every part of the body. So it causes damage to the blood vessels in the brain, the nerves, the heart, and the kidneys.
Right.
But we can see it on an eye exam first.
So these are all the comorbidities that come along with diabetes if it's not controlled.
Yes, absolutely. Or if it's undiagnosed. This is a great diagram that shows all the different parts of the body that are affected. So, it's the leading cause of blindness in the working age adults in terms of diabetic retinopathy. A lot of patients with diabetic retinopathy will at the same time have diabetic nephropathy, which is a leading cause of end-stage renal disease and dialysis. Diabetic neuropathy, which is a leading cause of non-traumatic amputations of people's toes and feet. And again, it really increases the risk of having strokes and cardiovascular disease. So, this is a good slide that sort of shows the different parts of the body diabetes can affect. And I've diagnosed people with diabetes based on an eye exam that didn't even know they had diabetes. I see hemorrhages in the back of the eye, and then I say, hey, you really need to see your general practitioner.
So get the A1C checked out.
That's right. Now the A1C is the measurement we ask all patients about. That's a measurement of your average blood sugar level over past 3 months. And so you'll hear patients talk and doctors talk about numbers like 7 and 8, and we've seen as high as 12 and 14. But again, this is a 3-month average, and really the goal is less than 7. Yeah. So if we can have it less than 7, that's ideal in preventing progressive damage.
So this is fasting blood work.
Typically, but the A1C, because it's a 3-month average, the A1C, you don't need to fast before getting an A1C measurement. It just it's an average of how much glucose is bound in your blood over the last 3 months. Okay. And the 5.7 to 6.4, you'll hear these numbers. These are pre-diabetes. And actually, some of my pre-diabetic patients also on examination can have signs of retinopathy developing. So even pre-diabetes is a time when really we need to get things, it's sort of a sign that we need to get things under control systemically.
So with A1C levels for the last 3 months should be under 7, but pre-diabetic 5.5?
Less than 5.7, some say less than 5.5, around that. You want to be less than that.
One has to then see an eye specialist, a retina specialist. that's when they come to you. And if they are seeing any symptoms like blurry vision or floaters or not seeing too well in the dark, these are some of the mild symptoms.
Actually, so that's what people think, and a lot of doctors and patients are under that impression. But the truth of the matter is, when you have symptoms from diabetes, that's usually late stage diabetes, and that's when you usually are going to require treatment in the office. But the early, I would say even moderate stages of diabetic retinopathy, when damage is going on in the retina and there's bleeding in the retina, there's no symptoms for that. And patients will walk around with perfect vision. And that's the danger with diabetes. The danger with diabetes and diabetic retinopathy is symptoms are most apparent in the later stages of the condition. And at that time, it's pretty far gone and there's a lot of damage done. We can, with modern medicine, we can really treat that. And as retina specialists, we can help regress and reverse diabetic damage. But again, the early and moderate stages patients will have no symptoms.
That's scary. So you're asymptomatic and you're having diabetic retinopathy. So the key point is to be checked out if you're diabetic and you feel that something can go wrong with your eyes. Best to be checked out by an eye specialist, a retina specialist, every 6 months.
Yeah, 6 months to a year, depending on the A1C level, but all diabetics, and I would even add, because of what I'm seeing in the office, I would even add pre-diabetics. If you're pre-diabetic, if you're diabetic, if you have a strong family history, these are patients that really require at least annual, and like you said, maybe every 6 months, eye screening to make sure they're not developing the early stages of diabetic retinopathy.
6 months or at least annual eye
Yeah.
screening, very important. Get your eye dilated, and the retina specialist can check the back of the eye and see what's going on. Share some more symptoms in the advanced stages.
So a lot of it is like you said. So in the advanced stages, when symptoms develop, patients can have a sudden onset of floaters, which can actually be blood that's bleeding and floating around in the eye. They can have blurry vision, one or both eyes. Sometimes it's just one eye. The other problem is sometimes when we have two eyes, one of them may compensate for the other one. And so you might not notice the symptoms in the late stage of diabetes in one eye unless you cover the other one. The brain has a remarkable ability to adapt. And so really, I encourage a lot of patients from time to time to cover each eye and make sure the other eye is okay.
You have some slides to show how the damaged blood vessels look like.
This is the early stages of diabetic retinopathy. So again, this is a stage where you're seeing blood here, and you can see the bleeding here. We call this the mild stage, mild non-proliferative diabetic retinopathy. This patient would have absolutely no symptoms. This is in the retina all the way in the back of the eye. So no one can
no
see
redness in the eye, so you can't see anything what's going on.
Yeah, you're 100% right. The eye is white. There's no symptoms. No one else can notice this. This is when the eye is dilated and we're looking with, advanced imaging at the back of the eye. So you're absolutely right. Yeah, the eye is not even right at this point. And so now you have the early bleeding here. Again, patient has no symptoms. And then I want to show you this slide because this is the moderate to severe stage. We call this moderate to severe non-proliferative diabetic retinopathy. You can see all the hemorrhages here. This patient may still be 20/20 with perfect vision. So there's a high chance that this patient is walking around 20/20 vision, no visual complaints. The eye is white, but meanwhile, they have significant diabetic damage here. And this is like the borderline stage before patients really get in trouble and get to the vision threatening stage. You have to keep in mind, and as I see patients with this type of presentation, it's important to note here that this usually happens over years of diabetes that sort of is either not controlled with, elevated A1C or has gone undiagnosed. And while we see the bleeding in the small vessels in the back of the eye, that same process is probably occurring in the kidneys, in the brain, but these are not, readily, we can't see. We can't just see inside the kidneys or inside the brain. The eye, we're fortunate we can actually see there, but this is a systemic process that's affecting the whole body. So, patients that have this level of retinopathy, we have to really get their A1C under better control.
Some diabetic retinopathy patients can see advanced stages very quickly, and some it may take a long time. So it's patient to patient.
Patient to patient, and it varies based on their level of A1C, right? So how well is their sugar controlled? Because if it's controlled well, like for example, if I have a patient with an A1C of 14 versus an A1C of 8, the 8 may progress, but it will take probably years. That 14 I would watch every 3 months in my office because I know they're going to develop retinopathy very soon.
Let's say they are able to control the A1C, but they've already gotten between moderate and advanced stage. Will their blood sugar then control the diabetic retinopathy and not progress it?
To an extent, and that's a really fantastic question, and it comes up all the time because you're right. I have a lot of patients where they at one time were diagnosed with diabetes and their A1C was very high, and then they started changing their diet, they got on their medications, and now their A1C is controlled. But the problem is once your A1C is that high and you have damage to the retina, a lot of that damage persists because those blood vessels are permanently damaged and they're permanently going to leak and cause issues. I actually want to show you my next slide, which shows advanced diabetic retinopathy. This is the stage that patients develop symptoms. But at this point, this is very advanced.
So there's a vitreous hemorrhage as well.
Vitreous hemorrhage. You see over the optic nerve, which is that yellow area, you see all these new blood vessels that have grown. Those are abnormal. And this left untreated, if we're at this stage here, this will lead to complete blindness. But luckily we have treatments that can reverse this now. And that's just in the last 15 years or so. Some of our treatments are actually very good at being able to reverse this.
So how much can we reverse it at this point of time with treatment?
The treatment is extensive. It requires monthly injections into the eye of medication to regress these blood vessels, stop the bleeding. So it's monthly treatments, and again, injections in the eye, and oftentimes laser also will be needed. And with a lot of follow-up, a lot of different treatments in the office, a lot of this can be reversed. There may still be some vision damage and loss of vision, but we should be able to halt it here and prevent progression.
Key point here is early intervention, and I want to reinforce that because it's so very important. If a person has diabetes, you've got to get your A1C levels checked every few months. It's not controlled, then there's a red flag. You're prone to diabetic retinopathy, and we already talked about that. Over 9.6 million people in the US suffer from diabetic retinopathy, and 1.8, as I mentioned earlier on, have vision-threatening diabetic retinopathy. Taking ownership of our health, very important, along with your ophthalmologist, your retina specialist, and your healthcare provider. So you're all part of the patient-centric team. You've got to play an active role to see that your diabetes is controlled with proper treatment. You've got the medical diagnosis of diabetic retinopathy. So A1C levels, and at the same time, get your retina checked out, at least, if not 6 months, annually. And nutrition plays a very important role. And that's where eye care, health is important, preventive care is important. So let's talk about nutrition, my favorite topic. Having proper lifestyle modification becomes very, very significant in everybody's life, but more importantly with people who have diabetic retinopathy, so that they don't have all these comorbidities.
I think you really nailed it. I mean, I think the healthcare team, the patient plays probably the most important role, right? You as the patient, you are the center of the team, and I think again, nutrition in patients that have diabetic retinopathy, but actually in everyone, in you and me and everyone, nutrition is important because this food can either be medicine or food can be poison, right? So what we eat is very, very, very important. there are a couple of antioxidants that are of utmost importance for all of us in maintaining healthy retinas as we get older. So lutein and xanthine are very important. These are antioxidants found mostly in green leafy vegetables. Carrots will have them, but surprisingly, broccoli and spinach and kale will have definitely higher levels of lutein and xanthine. Red peppers, a lot of this can be found naturally, and in patients that really can't get it naturally, you can take a supplement. But I really prefer if you can get it in food, I think I prefer that.
Beta carotene, like carrots, and we have super greens, kale, chard, all the greens, broccoli. Avoiding all the junk food because it's so easy to get it. So it's important that we stay away from that, especially if you're diabetic. You got to control your sugar. Now you got an eye issue over here, so has to be carefully monitored. Food, diet restrictions, important that diabetic retinopathy doesn't progress. More useful tips that you can give to diabetic retinopathy patients.
Yeah, so great question. I think fruits and vegetables generally have great nutrients and nutrition, and a lot of nutritional value come from fruits. The only thing is, in patients with diabetes, and I see this in my patients, we have to be careful with the fruits, because fruits are also a really large source of sugar, and we know they're beneficial for us, but in patients with diabetes, you have to sort of watch that carefully. The other thing is, with the green leafy vegetables, if I have patients on blood thinners, they really, before they start adding a lot of different things into their diet, sometimes they really need to speak with their primary care doctor or their cardiologist who's managing their warfarin or Coumadin to make sure this new diet and the nutrients they're going to take from food are not interfering and thinning their blood and that sort of thing. So those are important things for diabetics to keep in mind.
Any new modalities of treatment that have come out in the recent years?
Yes. So treatment of diabetic retinopathy has really progressed. So, I'm going to show you some photos later on, but one of them is laser treatment, which has been around for a long time. And laser treatment obliterates the peripheral retina and stops the growth of new blood vessels. The new treatment within the last 15 years or so are the injections, which actually help not only to stabilize, but in many cases, reverse the bleeding and the damage from diabetes. Of course, controlling the sugar overall plays an important role too. It's sort of a combination of the treatments in the eye and maintaining the right sugar level that really helps.
Do you see a lot of patients who have been diagnosed with diabetic retinopathy?
We see a lot of patients that are either diagnosed by us with diabetic retinopathy or referred for treatment. So a lot of patients get referred in to see me just for their optometrist or their regular eye doctor noted diabetic retinopathy or the beginning of it, and then referred to me for treatment. So we see that, and we diagnose it plenty of times also. And like I said, sometimes even in patients that didn't know they had diabetes.
That is a scary part of it.
Yeah.
And what has been the success rate, especially for patients who have been diagnosed at early stages?
Early stages outcomes are definitely better. So early stages and prevention, it's sort of that old thing, right? Prevention is so much better than treatment. If you could prevent it, if you have early stages, if we can prevent you from even needing treatment, look, Dr. Renee, no one wants to have injections in the eye. We numb the eye very, very nicely. We make sure you don't have any pain, but it's not it's just the sound of it. Most patients, hate that. And if we can control the sugars with the early stages of diabetic retinopathy, and we can reverse that just naturally with better A1C control, better sugar control, so that the patient doesn't even need treatment, that's always the ideal situation.
Thank you very much, Dr. Deep Parikh, retina specialist, associate clinical professor of ophthalmology, New York Eye and Ear Infirmary at Mount Sinai and NYU. Please take ownership of your health so that you are free from all these comorbidities that can happen with diabetes.
Thank you. Thank you so much for having me and for talking about this very important topic.
Absolutely. And I'm Dr. Renee Mehrra. Stay healthy, stay positive.